Hi everybody, my name is Rhys Barber. I'm one of the audiologists here at Audiology Associates. Thanks very much for watching our earwax removal video today. 3 patients in this compilation. There's a mixture of mine and Taylor's patients in this one. Taylor wasn't available for the voiceover today, so I'm going to voice over one of his for him. So you can see we've got this very, very thick, quite soft wax, this one actually, at the entrance here. You can see it's kind of peeling away from the side of the canal wall as we try and lift this up. This is the standard size ulnar tube in here. So you can see I'm giving a little bit of a wiggle. It's quite dark in colour, which means it's that little bit older wax in most cases. So we're just trying to peel as much of this off. It's super sticky. It's like almost like chewing gum. It really wants to stick to the surface and doesn't want to come away very easily. You can see the slightly harder section here in the center. There's more sort of clay type wax there in the center. So I'm just trying to get a grip on this and wiggle this out. There we go. We're starting to see a little bit of movement. You can see that top section just starting to pull forwards a little bit now. So let's give this a bit more of a wiggle. There we go. The bottom section's gone as well. You can see a little bit of oil that was in there as well. Patient had popped in just to try and loosen this up, soften it up before they come along. But there we go. Eardrum looking nice and healthy there. So this is what it looked like beforehand. This is what it looks like afterwards. So a very big difference there. So a centimetre. Right. Somebody said there's a ruler there. This is mirrored on mine. So I'm going to say that's 3/8 of an inch, that is. We had these rulers arrive in clinic with no notes, nothing attached to them, but they're all in imperial, so they're all all inches and very handy little things to have. But we've got no idea who sent them, so thank you very much to whoever sent those in. You should have left a note. I want to give you a shout out on the videos, but thank you so much whoever did that for me. But this is Taylor's patient now, so you can see. Now I've never seen this one before, so it looks like a very soft type of earwax here. A little bit of skin, a little bit of keratin here at the entrance to the canal. Very soft stuff as well. Oh, it's very, very mushy in there. Little bits of hair as well. Let's see what we can see beyond this then. So, oh yeah, you can see it's very soft. Oh, patient, I would say, has probably used a lot of drops in this one. You can actually see the liquid in there as well. So I would imagine this patient had a lot of drops going in here. Just trying to break this down. Now you get this much lighter color with wax sometimes if somebody's used a bicarbonate or a peroxide based drop, and that tends to turn everything to a bit of a mush, and that's what we're seeing here as well. Now a couple of people in the comments in the last couple of videos I mentioned about irrigation. Now this has been something you guys have asked lots about in the comment section. About, I thought irrigation was banned in the UK. I know some other audiologists say, don't put water in their ears or anything. I know Neil says that. But irrigation has been used for a long old time here in the UK, and it's still used. I think what you've got now is a new batch of machines, a little bit safer to use. And I think that there is certainly still a call for irrigation. I think that microsuction is a fantastic way of getting wax out of people's ears. It's a great, great method of getting wax out. And because you're visualizing in there, the safety aspect's absolutely fantastic. Irrigation, though, has much more call for, this type of wax here, this very soft and sludgy type of wax. Great for that type of wax. It's much easier to get that wax out using a rinsing method, which is what we're going to use as far as irrigation is concerned. So much easier procedure to do as far as this type of wax. If you were flushing this out of the canal, it just makes it so much easier. And because otherwise what we're doing, you can see here, we're having to sort of very slowly work our way down and suction, quite close to the eardrum sometimes, just above the canal wall entrance. Oh, well, look at that, the canal wall skin, not entrance, I'm sorry. But, peeling that away. Now, Taylor's managed to do that really effectively, and it's come away really easily there. But there are some that you get this very sticky, we talked about that sticky chewing gum wax earlier. You can get that all over the eardrum. Very difficult to remove. That's irrigation would be a fantastic way of getting that out. And it would be, very easy, quite pleasant for the patient as well. If you guys want to see us do an irrigation so you can get a better idea of what we're talking about, it's only shot from the outside of the ear, obviously, because the ear canal is full of water. But I'm more than happy to do that. Just let me know in the comment section, and myself or Taylor, or both of us, maybe start recording some of these irrigations from the outside so you can actually see what's going on, what we see as the wax comes out. Let me know if that's something you want us to do. The other thing it's very good for is if you've got really absolutely solid wax. It's great sometimes sometimes as a combination method, lose you a little bit of irrigation just to break that wax down a little bit, and then use the microsuction to remove the remainder. Also great little technique, and I've done that quite a few times recently as well. I know Connor up in Durham does that as well. So yeah, guys, let me know in the comment section if there's something you want to take a look at. Now, this is the other ear canal in Taylor's patient here. So you can see a much more solid block in here. So that much thicker, kind of harder wax. Now, he was obviously using the fine end just a second ago because we switched up size now. This is the standard size on the tube. And sometimes if you've got these much harder plugs, there is a better way of getting a good grip on this. So this is coming out really, really well. There we go. Look at that coming away. Quite dense hairs as well. You know, they're quite tightly packed in there. Very thin themselves, but very, very tightly packed little hairs. So what have we got now? We can see the eardrum beyond. So we're having to sort of tidy up here. We're switching down to the fine end. I'm saying we, it's Taylor. Taylor's switching down to the fine end just to get rid of this. Looks like a little bit of keratin here at the entrance to the canal. There we go. That bit's gone. Another little piece just above, so we'll go ahead and grab that now. Don't forget, guys, if you do suffer with earwax problems yourself, you can always check out a link to the bio, take a look at the channel page. It's got a link to our website on there. You can book yourself an appointment. You can come and get this done yourself with myself or Taylor Green. If you do enjoy the videos, don't forget to like, share, heart, follow, and subscribe for us. That'd be absolutely fantastic. So Taylor here is having to peel this keratin layer off the canal wall. You can see he's taking it very, very slowly. Difficult layer to remove, this one. Very, very dry. He's painstakingly actually just lifting. What you have to do with these types of cases is lift a little bit, push the suction tube on just so we minimize any risk of clarinetting, and then keep pulling all the way down. And that's what's happening here. It's a very, very gentle peel. I think in the next couple of videos, you're going to start to see Taylor's, obviously this is Taylor's old camera, so you're going to start to see Taylor's new camera popping up as well, so you'll be a little bit of a clear image. But there we go. That's all done. No ruler shot for that one. This one is actually my patient here. You can see very, very thick layer of wax in here. Now this looks quite solid first glance. Let's take a look. That's a little bit softer. We're probably going to have a little bit of a nugget in there somewhere. Yeah, you can see just by how that wax moved then, as we got a grip and just started to wiggle it a little bit, the whole plug we saw move. So we know that it's got that slightly harder core to it. Just going to pull this away. Little bit more of a wiggle here. Taylor will be back for some more videos, guys. I think we've got a voiceover section. We tend to do voiceovers in blocks just because we're not together very often in clinic. We're usually at opposing clinics most of the week. We're only together about once a week, which is why we have a good old natter when we are doing the voiceovers, because we have a good old catch up. Yeah, I think he's with me tomorrow, and we'll be doing the voiceovers for Friday and some of the voiceovers for next week as well. Yeah, I know he's on leave then for a week, so you're back to just me on my own for a little bit. And then we're back together again after that. So we've got it so far. We can't get it out any further than this. We've got to use the Jobson horn here. So just pulling, just a little bit of, I think that was a little skin flake. It just covered the camera there. It just fell off, you saw. But out that's coming. Let's get rid of that section. Let's go beyond this now. It's on its way. There we go. We managed to pull it forwards and down slightly, so it means we can drop behind it. Let's give this a good, it's just broken away. Well, unless it pulls from this bottom section and pulls the whole thing. No, it did shear off. There we go. So you can see that layer coming away there, quite a dry, it's going almost crumbly now. That's where we're at. You can see these little sort of blurry patches on the camera here. What's happening is there's a little bit of dry skin at the entrance to the canal. So when I'm going in, it's picking up these little sort of dry sections. Just flicked off the top there. Let's get beyond it again. There we go. It's on its way. Oh, look at that pulling away there. That is a chunk. Look at that going. I think that's the whole thing. Out that comes. Yep, look at, and you can really see that drier keratin layer underneath there. That thick, crumbly type wax. You can see the ear canal's dry. It's really common when you get these dry flakes of skin on the outer part of the ear canal. You'll normally see a very dry canal further in as well. We used a lot of olive oil in this one, but look, so you can see it's almost got that sheen to it, and we've got this almost like this sort of knobbly surface to the wax as well. That's normally a good indication you're looking at some very dry, almost granular pieces of wax all bound together. We talk about that sort of butter and sugar mix. Imagine that, but with a lot more sugar in, so it almost goes very crumbly. It's coming away nicely there. You can see a little bit of dry keratin skin there, just as we're coming back. There we go. That's the piece I was talking about, just hanging onto the top of the canal. Oh, awkward, these ones, because sometimes they'll form in really awkward shapes. They don't always form in a nice, smooth, consistent shape into the shape of the ear canal. Sometimes you'll get these very sort of angular shapes to these pieces of wax. Got the Rosen inserter in here. Now, when it's granular, I don't think this is going to do a lot. Now, when it's a granular piece like this, it's always going to shear away. It doesn't matter what tool you use, it's always going to shear. Now, the reason I've opted to go for the Rosen inserter here rather than the Jobson, oh, look at that come away. That was a nice chunky piece. Rather than the Rosen inserter, rather than the Jobson, oh my goodness me. Let me start that sentence. You can tell Taylor's not here. Well, the reason I've gone for the Rosen inserter rather than Jobson horn is because that piece of wax was a little bit more mobile. Now, to try and get beyond that, I would have ended up pushing that wax further in, whereas the Rosen inserter's got a much thinner hook end to it. It means we can just get over the front section and shear that away. And then we can, because we've taken half of it away, then we can start to reposition, maneuver this wax to the outer part of the ear canal. You can see just how crumbly this is. All these little tiny pieces all just starting to break away in there as well. So it's coming away really nicely. There we go, out. This is coming. It's starting to come away in these tiny little pieces now. We're going to have to get rid of some of these looser pieces before we can get a good grip on this larger, deeper section we can see here. There we go. Now you can see that whole deeper section starting to move. If you look just beyond that front section, you can see that more sort of deeper, more medial, whoops, almost lost my mouse, almost medial portion of the wax. They're just moving forwards as well. So we're just getting this out. Don't forget, when we talk about lateral and medial, guys, lateral, anything towards the outer part of the body, medial more towards the center of the body. So we talk about lateral and medial wax or lateral medial ear canal. That's what we're talking about, is either the outer bit or the deeper section. So this would be classed as medial because it's much deeper in. So we can see this starting to move now. These little crumbly pieces, that's the only downside of this. When you get these little tiny crumbly pieces, every time we go and get that grip on the bigger section, a little bit will break off. Ooh, turbo wiggle, out that comes. There you go. You can see very dark in color as well. We talked about this being much older wax. There we go. And we've got this very, well, I was going to say thin, but it's not. It's more rope-like hair in there as well. So just getting rid of these outer sections. There we go. I'm just looking, you can see I'm checking that hair out just to see how I can get a grip on this. You know, whether I can get a good enough grip on where I can get that grip. There we go, out that comes. There we are, and we'll take a look beyond it. There we go, there's the eardrum there looking nice and healthy. I'm sure there's a ruler shot on this one, so we'll just check on that. Yep, there we go. So we go, so we've got 4 centimeters, 1.5 inches of earwax there, guys. Well, guys, I hope you enjoyed that video as much as I did voicing it over. Myself and Taylor will be back together for the next couple of videos, and I'll be just back to me on my own again. Let me know in the comment section if you want to see some irrigation from the outside, so you know what we're talking about. And guys, as always, take care of yourselves, take care of your ears, and take care of one another, and we'll see you again real soon. Bye, everyone.